get things. But you don't want it to do it during the lunch as well. There you go, you have a soft one, that's the way to go. Monday. We were planning on Monday. Joel says he was that, we need to talk to Joel.
Yeah.
Because Joel wasn't, I wasn't sure if we were changing the date because he wasn't sure. But we were planning on Monday, the third.
Joe, so I guess we're planning on Monday, pictures and
Unless you don't think we'll have the backdrop by then, because then we can postpone it. We just were planning, since we were going live that week with the public, that you would want to.
got it. Here's the biggest key, is it's gotta be a consistent background. That's my biggest key, is that you've got, stand here for a second there, you've got Sarah, and you've got about 5 different backgrounds. So it's gotta be a consistent, where we have a background on the wall and we put tape down where the camera goes and tape where the person stands, so it's the same for everybody. My thought was putting the camera, doing that in the basement, in the foyer area of business services. I mean, we can set it up over here somewhere, and that can do it all week.
And outside the picture, it would be, I mean, to your point of consistency, those would be different. I mean, if you do it in the basement, right, the lighting would be different. So, but,
I mean, as long as they're closed, it's not like we're gonna have 12 employees standing next to each other.
Get it out. I think
So,
that's
but-
a blank shot, pretty consistent pictures, because it
Yeah, but I mean, if you point to look at Jordan's, it's got literally just your head, and then you have your shoulders.
But come look at these. Yeah, I'm like,
I told him to zoom in on my face.
You gotta hit both sides while you're going there. You do this side too, and then I'll go down. Sure.
We go.
Bruce, you got quite a mess going on out there.
Yeah.
You're welcome.
It's bound to get better.
This one,
If we're doing it Monday,
it's not 13, it's on the 13th. We can give them here and then. It's just, how do we, where do we set it up? How do we coordinate it?
So, we thought that we were just do 3 stations if we advertise. I didn't know. Excuse me. If you're just
Good morning, how's everybody doing? Well, good morning, how's everybody doing? It's nice to actually finally have some spring outside, so let's just hope it stays that way for a little while. Welcome to the April All-Staff Meeting. We'd like to start off by welcoming any new members of staff members that have not been to an all-staff meeting before. Anybody hasn't been here? Would you like to stand up and introduce yourself? Welcome, Haley. The back row, you're being shy.
I'm Mandy Larson, and I just started at Alpine Urgent Care.
Sherry?
I'm Sherry Morrell. I'm the Patient Services Director.
Sorry, you gotta put her on the spot.
Catherine Matern, I'm the VP of Quality and Patient Safety.
Fantastic. Sherry, is your sidekick Tim? Here's David. David, where you work? I'm David. He's down in the basement of the business services. Casey, have you been to one of these meetings before? This is Casey. She works in the Cokeville Clinic. So, all right, well, welcome. We're going to turn the time over to Tori right now, so she can start us off.
There's plenty of seats in the front.
The whole front row.
There's lots of seats over here.
We are going to start with an activity.
You sit like that. Because
it involves everyone's participation. So everyone's going to participate in this, and we're going to talk about the patient experience here at the hospital and how every single person in this room will affect the patient's stay. Well, it's a hypothetical situation. It very well could happen. This particular one that I'm going to do may be a little far-fetched, but I'm doing it for a reason, because it really could happen. It just probably never has. But we're going to talk about the patient who comes in and is going to get a total hip replacement, and how many people throughout their stay will touch and affect this patient's stay. So if somebody comes in and they're going to get a total hip, what's the first thing to say before they start?
they're going to make an appointment for the doctor first.
Appointment for the doctor. So how do they know that they're going to go to the doctor?
Well, if they call,
Right?
yeah.
Word of mouth, advertising, things that they look up, they Google, right? So we're just gonna put that as advertising, but word of mouth, they probably heard from a friend, hey, Star Valley's great, go to orthopedics, okay? So we're gonna start with, and I do a lot of abbreviations. So advertising, we're gonna start there, okay? And then we're gonna go to Salt River Orthopedics. And the first person that they're gonna talk to there, I'm gonna kind of draw, is admissions, right? They're gonna call and make an appointment. So when they make the appointment, that's their first interaction with Star Valley, right? They come in for their appointment, again, they're gonna see admissions again to check in, right? And then they're gonna get called back by name. Yeah? Stop me if I'm. And then they're gonna either speak, they'll probably see a doctor first time with their CTA as well, right, depending on. Probably they'll get X-ray, CT, something, MRI, to indicate what the problem is if they're coming in with that pain, right? So radiology. And then they'll probably be, this will probably be, it's
Radiology, we're going to check it for that.
so front. Okay? Radiology, and then you go back to the doctor and make a plan, right? That may be 2 different appointments, am I right? Sometimes, so possibly times 2. And then they'll say, okay, you need surgery, so where does it go from there? So they go home, and then who they're gonna get contacted by for surgery. Yeah, right? So they're getting contacted with the, and that's both billing and the surgery. And so surgery will also call them to schedule a day. Or talk to them about when they're supposed to come in, things like that. Does billing call them to, or is that pre-op in regards to bring this amount of money? Yeah, okay. So, when they come into surgery, the first thing they're gonna see is admissions and surgery, right? So surgery admissions, and they're gonna go back, there's a CNA back there, there's an RN back there, pre-op. Anesthesia, right? Doctor. It's gonna keep going out. EA. Sometimes a lot of the doctors have reps back there with them when they go get into surgery, but this is just in pre-op, but they'll see the OR RN in pre-op to kind of discuss what's gonna be like back there. They might have lab work. They may have lab practice over here as well. So right here, off of this one, I guess I should go back off of Salt River Orthopedics. If they say you're gonna get a full joint, then they have to go to their primary care to get clearance, right? So we're gonna come back over here and they're gonna go to their primary care. And if it's here at this facility, then we have all of those people as well. Admissions at that clinic, they may have lab work, they may get an EKG, that's respiratory, outpatient, MA, for primary care, then back up to surgery. Okay, so then we're gonna go into surgery, and in the OR, we have the surgeon, usually a PA, the tech, the surge tech, the RN, radiology, the rep and radiology. And then, am I missing anybody in that?
They got the person that sterilized the equipment.
Yep. Okay. So up over here to get the equipment, right? So we have sterile processing. We have CS with all these areas, right? And up here feeding everything. How about environmental services? Yep, exactly. How about pharmacy? Pharmacy is feeding into all of this as well. We don't have our medication, we don't have supplies, we don't have environmental services. We couldn't do any of this, right? What else is up there? We have to have staff to do it, right? So HR.
Facilities.
Facilities. Really, we can
The finance, because you have to be able to
pay
pay
for
for all the
everything.
equipment and.
Yep. Finance, be able to pay for everything. Okay, so after they get from out of the OR, they're gonna go to PACU, right? Sorry, my PACU, looks like an R, but it's not. And in PACU, they have a different nurse, right? And they may have somebody else who assists, but it's usually, the anesthesia will help back there as well. And then from the floor, they go to the floor, right? So now we're on med-surg. So when they get to med-surg, how many people do they interact with there? Clerk? I'm gonna put discharging you are. PT. Dietary, we do have environmental services that go in the rooms down there, right? We have hospitalists, so a different doctor, they're still gonna see their doctor, they're still gonna see the PA. And then all these things, like workbook, RN, CNA, that can be times X amount, because they're here for 3 days, right? So they're gonna get 2 different ones per day. So that's times, we'll just say times 12. But, I mean, they're gonna see lots of people that do with respiratory, that could do with PT. We do have an inpatient physical therapist, but if he's gone that day, you may see somebody different. Lab. Pharmacy. Radiology. And how about the family in all of this? Even from the very beginning, is the family involved? Do they have their own experience most of the time, huh? They have somebody that's coming through this with them, and they might have a different perception or different needs. If we're in the OR, who's talking to the family about what's going on, are they hungry, do they need something to eat or drink, what's their perception? Okay, so then this patient stays for 3 days, they feel like they're doing great, they're gonna go home, and at home, even though it's not necessarily our services it may be, they may do our outpatient PT, right? Outpatient PT, home health. So, yeah, we're gonna do that. That's what I'm gonna do. I like it. So, home health, and then even our med surg here, so they need equipment. So then we have an outside agency come in, say they need a CPN, we have, so we have an outside agency come in that we're recommending, right? And they come in their room and they talk to them, so we'll just put equipment. Okay, so yes, I like where you're going with this there. Then a couple days later, they come back in, they call the ambulance because they fall. Something happens, maybe somebody has to them, or they fall home, they call the ambulance. So then they have an interaction with the MS, right? And they're gonna come in, and since this patient just had a recent inpatient stay, we can bring them back in as soon. Correct?
Only better for the inpatient days.
Yeah, they did. It's a hit. They have 3 inpatient days. I'm going somewhere with this. You'll see where I'm going with it. So, do they go through the ER? Okay, go through the ER. And so EMS, they're going to have an EMT, they will, a driver will still be on scene, paramedic. So they're gonna have that interaction with EMS. They get to the ER. There's admissions in the ER as well, even though they're coming in by ambulance, admissions will come in to get paperwork signed, right? They have a CNA there, they have a nurse there, different doctor there, yep, radiology, labs. And now we decide this patient's getting admitted again for swing bed because they need more rehab. So they're back to med surg. I'm not gonna rewrite it all, but it's all the same thing as up here, all those different interactions. And we really have had this happen where people come back in after an inpatient stay for swing bed. That's how we operate. During their swing bed stay, we decide the patient's not getting better, they don't have enough help at home, they wanna go to a care center. So we're going to transition this patient. That's why I said it's kind of far-fetched for total joy, but hey, it could happen. You want to go to the care center. So then we start that conversation with the care center. And in all of this, there's a big piece. So back probably during this transition, what's going to be coming in to the patient? Bills. So we're just going to put bills. And if they have questions or concerns, they'll be calling and speaking with them in regards to that. So we transition to the care center, and who do they interact with at the care center? Who's the first contact?
Is it Mary?
So the admission's over there, right, to make sure that they're a candidate. And then that transition, they might go get a tour of the facility, everything like that. And then once they get over there, they have the RNs, LPNs over there, social worker, CNAs, activities, speech therapy,
Housekeeping is gonna have 2 sections, because we also do their laundry, so we clean their room and wash their clothes.
okay. So
office person, which is usually yours.
Huh?
Our office person, which is usually yours.
Okay.
There's also such an amazing state of administration.
Don't worry.
No, honestly, I look at over here, I mean, just with finance, we have to have administration to be able to make everything run and us to be feasible and everything like that. So, everybody in this room, did we hit everybody? IT is up here. Definitely, if our computers don't work, and we can't do orders in, we can't communicate with people, the phones are down, we definitely need.
Financial counselors. Because if they can't afford to pay, they need to call and apply for charity care. Right?
There's a lot of
You
interaction
know,
with
look at this, like 60 bills or something.
with a ton, either right with the patient or behind the scenes, just as important in regards to, we need the equipment, we need everything to make this fully function, right? So every single one of us has a huge impact on this patient stay, and we do an amazing job. And it was really eye-opening to me when I did this activity of how many people, like, yeah, you think, oh yeah, they go to the hospital, they see the doctor, they see a couple of people here and there, but when you actually lay it out, there's hundreds of people that are behind the scenes or with the patient physically, and that can affect their stay, both positively or negatively, depending on what occurs. So, you can say everything does great up until med surg and something happens and there's a hiccup. You think here on out they're gonna have a great experience? You might be able to turn it around, but it just takes one time for a hiccup. But we also have so many positives that I think that we do an amazing job. So I hope this was helpful for you guys as it was in regards to how we all can affect the patient's stay. And on that, I have our patient satisfaction scores. Wow. Thank you guys for all you do. We couldn't do it without all of you. We really couldn't. Okay. Thanks. So this is our last quarter ended in March. So it's January through March in regards to our patient satisfaction. On the side are comments from patients in this area. This is surgery. 75.6% of the patients rated us at the top box, meaning that they recommend our facility and they gave us the top score. So that's a 3/4 of the patients gave us the top score. I think that's great. If you compare that to the percentile rate, surgery is a really competitive area in regards, and just a couple we'll show you on med surg, but even if you can just change a couple people's perception and put them at the top box, it changes your percentile rate quite substantially. So, and the comments are great. So, and there's also some that we could work on as well. The ERs, 79.7% top box, so again, 3/4 of the patients, a little more than 3/4 gave us the top score, and that's the 89th percentile rating, so that's great. Green means that's, we're really competitive, and working on it, really means we can work on it, so. Like how we talked about the no waiting time at the ER, I think we're really lucky to not have a wait time in our ER, the majority of the time. Has one about their x-ray. And then some of the ones we can have these more friendly, making sure we don't make people feel like they shouldn't be. Inpatient, 72.1% top box, and that's the 87th percentile rate. And this is the one where our percentile rate jumped quite substantially this week, very different patients, rating is higher. We can always work at quiet at night. That is always one. Always, 100%. And then the medical practice. So I think it's great that in all of our areas, 3-4 certifications gave us the highest score possible in all 4 areas. That's amazing. And with medical practices, we've had a lot more samples. A lot of people actually did the survey and returned it. We fixed the little glitch that we had, so the sample size is much larger this go around. You did a very good job. Thanks, everybody. Okay,
I would like to turn the time over to Jordan to introduce some new information that's going on at the medical center.
Thanks, Corey, that's awesome. I wanted to point out, it's pretty amazing when you go through the whole process and every touch point that a patient goes through and everybody that they see throughout the process. And all of that, for me, in my realm, in my world, in marketing, is branding. It's really who you are as an organization and what you represent. And thinking about all those touch points, every single time that you're communicating with, treating, or associating with, even walking down the hall and smiling at, hopefully smiling at, somebody that you're passing, you're sending a message. And so that's where I live. That's my whole job, right? Is figuring out what messages are we sending to the community. I wanted to share this up there, or put this up there for y'all to see, because this was around the mid to late 90s. This ad was in the newspaper. Some of you remember it. I actually do remember the facility when it was like that in my childhood. And so putting that up there, I guess I posed the question, are we the same organization as we were in the mid-90s? I see some people saying, like this. Hopefully everybody's thinking in their heads, no, absolutely not. Both visually, we're definitely not, because that was just the old hospital, and that was the only thing that was here at the time. And so taking a look at that, I don't know how many people were actually here or around at that point. We've come a very, very, very long ways in the past 20, 25 years. Extremely. I wonder if you have the clicker thing?
Yeah, Corey did.
Checker pocket.
Push the one at 9 o'clock.
Perfect. So with that in mind, thanks, Brent. Putting that up here, so around, does anybody know when we officially switched over to Star Valley Medical Center from Star Valley Hospital? And don't cheat, those that have asked this before. Anybody know? approximately?
98?
98, close. That was very close, 98. That's a good guess. There it is, an answer in the back. 2003? 98 was closer. So officially, we, Intermountain Healthcare left October 1st, 1999. So they left, and it was then at that point that the North Lincoln County Hospital District, we organized and established Star Valley Medical Center. I think it was November 1st, 1999, so it was about a month of transition. I'm sure there was a longer period of time logistically to switch over. But November 1st, 1999 is when officially we became Star Valley Medical Center. At that point in time is actually when we adopted the name and the logo and our personality and who we are. And we started communicating messages and acting as Star Valley Medical Center. That was 20 years ago. Since that point in time, we have developed and grown tremendously in the services we offer and our expertise and things that we do here. However, one thing that has not kept up with the times and kept up with our services and adequately communicates who we are is our brand. On a day-to-day basis, yes, we're communicating messages, but holistically, as an organization, our brand has not been updated in 20 plus years. To give you a general idea, around every 5-ish years, an organization typically goes through a refresh of their brand. Doesn't mean they completely rebrand, but they refresh it. About every 10 years, they about completely refresh, completely redo or rebrand. It's been 20 years since we've done that. The unfortunate thing that does psychologically is we're putting the community and the patient's mindset, we're setting them back 20 years to what we used to be, not who we are today or where we're going in the future. So with that in mind, some of you have already seen this, some of you haven't. We'll be transitioning, and I'll get into the timeline and things like that here in a second, and switching over to Star Valley Health. We'll be adopting a new name. Legally, we will not be changing. Hopefully you saw the email from Bryn this morning. Legally, we'll still be North Lincoln County Hospital District. However, our DBA, or doing business as name, will be changed from Star Valley Medical Center to Star Valley Health. One of the main questions is why? Why are we doing this? Why do we need to change? And I go back to what I said originally. Are we the same organization where we were 20 years ago? Are we just a medical center anymore? And are we just in Star Valley, even a bigger question anymore? And the answer is no, we're not. We've drastically changed. And so to adequately represent who we are, where we're going, and what our bright future holds, transitioning to this name, adopting a new look, as well as kind of a new slogan we're going by, advanced, local, personalized care, that's who we are. And I feel like a lot of work has gone into this, working with directors, working with leadership, working with the board, asking several different employees to figure out who exactly are we, who do we want to be. And so there was a lot of work that went into this to kind of develop the name and to hopefully communicate who we are and where we go. With that in mind, every department will adopt the emblem. However, several other departments that are more externally facing, so you take a radiology, yeah, it's externally facing, but really we're not out there advertising, hey, come in and, you know, get an x-ray. Typically it's part of the larger hospital experience. So the organizations, the departments that are more externally facing, such as the care center, orthopedics, physical therapy, they'll kind of be their own sub-brand or sub-department name and have their own logo, using the same emblem to show cohesiveness and part of our organization, part of the family. However, they will be communicated more like this, as you see through advertising and things like that. Notice one of the big changes, working with Salt River Orthopedics, the physicians over there, and the director, Lynn, they'll be switching their name. They're moving from Salt River Orthopedics to Mountain West Orthopedics and Sports Medicine. Part of the sports medicine is also encompassing some of that pain management things that Dr. McClure has now moved over there, kind of getting a holistic approach, as well as the specialty and extra training that Dr. Limpert and Dr. Stuckey, as well as Dr. Washburn and Evanston have. So to encapsulate that. And of course, we have our charitable foundation on our auxiliary. As a whole, we are Star Valley Health, Bill. This is all part of Star Valley Health, this whole organization, parent organization. Timeline for the change. So sorry, I apologize because this is fairly small, but there's a lot of aspects to it. Just verbally, I'll express to you, starting today, right, everybody is aware, and a lot of you already knew, or at least several of you knew, going through this as of May 6th through whatever that first full week in May, the week of the Expo. 6th to 11th, is that what it is? That will be the official week that we launch to the public, that we release this to the public saying that we are now transitioning, we will now be known from here on out as Star Valley Health. That's the kind of the grandiose launch week where we'll have an interview on the radio with Bren discussing where we're going as an organization, what that means. There'll be an article in the newspaper. There'll be some posts on social media. The Thursday there will be the Health and Safety Expo where we'll actually have items, stationery, business cards. Hopefully all of you will attend, if you can, down in the Payne Community Center, where we'll have the kind of the first big event where we have this externally facing brand released. Followed up by Saturday is the fun run. So prior to Hospital Week, which will kick off Hospital Week for all of us the following week. So going forward, there's a lot of logistics, a lot of things around that, but as far as the timeline for you guys and how it affects you, so as of that week, we'll be going forward as Star Valley Health. However, we can't, I wish you could just snap of the fingers and everything changes, right? There are so many documents, so many signage, so many signs, things everywhere that we need to change. So for the timeline, starting that week, going forward, there'll be a 2-month time frame to switch stationery, documents, things like that within your departments. I'll be working with your departmental directors to facilitate that. However, this will extend, if you notice, it will extend with a deadline of September 31st, October 1, to have everything complete, including signage. So the goal would be, starting that first week in May, July 1, we would have stationery and patient experience apart from signage switched over. So stationery, business cards, any medical record, things like that. And then from July through September, the end of September, we would be focusing on external signage, and kind of where we are throughout the community there. So any questions regarding the timeline or anything I've talked about so far? Yeah.
I'm wondering, when we start answering phones, when do we start changing that?
We need to facilitate that. We need to figure that out. One of the things I want to try to avoid, and I've expressed this to the directors, I don't want to be handing out half of your items, half of the marketing material that says Star Valley Medical Center and has the old logo on it, and half of it with the new logo, because we're sending mixed messages. So I'm going to be working with your directors, and they will dictate, or I guess work with you on making a clean sweep within your department. So for example, Lynn Alexander, she's already jumping at it. When her department's ready to go, everything's switched over. At that point in time, the director will determine we're now set up, we have everything, all our ducks are in a row. At that point in time, they will switch over, but holistically, we need to come up with that date. That is a great thing to identify. And that's a good point too. If you run into issues, you run into concerns that maybe I've overlooked, Joel's overlooked, or anybody else, your director, please bring them up. This is a massive undertaking. So there are things that are gonna be hanging out there that I don't even know exist, but you guys probably do because you might use them on a daily basis. So please, please, please let me know. If you see something, hear something that needs to be changed or switched, or you have input about that. There's a lot of questions of why. Why do we even have this? Why do we use this? Now's a great time to kind of mini audit your department on what you're doing, why you're doing it, things like that. So, any other questions? That was a really good one. So I need to get back to everybody on that. Okay. Resources. So where can you guys go? What are things you can do? You can always contact me or Joel or any of the administration, your director as well. I'm starting to build out a marketing page on the intranet with specific information. I'm trying to make this a home for resources as well, marketing resources in the future. On the left-hand side, I'm going to be building out a library. Right now, there's that was sent out this morning, the frequently asked questions about, things, how the change is affecting you. That's available there. A style guide, something we haven't done in the past, where our brand, we've kind of just done whatever, whenever, and there really hasn't been a rhyme or a reason or a structure to it. Starting to build that out to communicate an adequate and consistent, concise message across the board. So you can always go here. The Friday flyer, every other week, we're going to be putting in an update on the branding, where we're at, what are we doing, what's happened, what we plan on doing, and as well as feedback. If a question comes up, somebody asks us a great question that's probably applicable to everybody, we'll try to include that in the Friday flyer with an answer so that we can disseminate the information as quickly as possible and as effectively as possible. So this will be a great place, the Friday flyer. You can always call, email me, and also discuss with your director. I'll try to work through them a lot to accomplish this. So I'll just cover some of the frequently asked questions now. This was sent out this morning, but when can we start talking about the change? Right now. If somebody asks, you can tell them. Obviously, you need to be strategic about it, and the main thing I would like to emphasize is that it's the representation of who we are and where we're going. That is why we're changing, realistically. To truly capture who we are and where we want to be as an advanced professional organization. What do we need to do before the launch? A lot. Not specifically you guys as individuals, but I need to do a lot, the director needs to do a lot, and I'll be trying to coordinate that with them. And from there, like I said, your director's going to be the quarterback. I'll be working with them on that, and it will be going throughout your department. I'll also be going around trying to answer questions best I can with each of you. Please bring it up. A lot of the times, things don't get done or something maybe isn't how you want it to be, but if you don't say anything, we can't do anything about it. So I would please ask, please, feedback, good, bad, and ugly. I'd like to hear it. How does it affect my daily activities? This is a major one, right? To Pam's question, there will be some minor logistical changes, maybe answering the phone a little bit differently, things like that. However, at this point, I put, in this explanation, like it says here, this is a great chance to audit yourself and your department and your team. How is your customer service? How are you treating our patients? How are the processes and procedures you're going through? Are the forms optimal? It's a great time to just check yourself on who we are. Because things are changing rapidly and we want to get to a certain point in communicating this brand, our new brand, right, that you're helping create and that you have helped create over the time you've all been here. stepping it up a little bit essentially, if I could put it in a very straightforward way. So it's just a great time to figure out, apart from the minor changes of answering the phone and things like that, who are we and who do we want to be and who do I want to be and how do I fit in the big picture. Can I wear your clothing? This is a huge one. People are always like, can I wear my jacket? Can I wear? Yes, you can. So Star Valley Medical Center attire, I would ask if it's a jacket, if it's a coat, if it's something that's more costly or expensive, keep wearing it. Absolutely, please keep wearing it. If it's things such as hats like Kelvin Screw wears or that Russ's Screw wears, or t-shirts, please work through your director and have the director come to me and we can replace the more inexpensive items, the hats and the t-shirts and things like that. As we move forward, obviously all of our attire, all of our clothing, it will be switched over to the new brand. But you don't have to refrain from wearing, I know a lot of you that have been here a while have the nice coats with Star Valley Medical Center on them. That's okay. You can continue wearing those. Not a major issue. Do we need a new website? No. However, the domain name will be changing from svmcwy.org to starvalleyhealth.org. Along with that, your email will be changing. But just the ending of your email will switch over to the new domain name, starvalleyhealth.org. What that means, your old email will continue to forward to your new email. So don't worry that if somebody's emailing your old email, it won't get to you, because it will. However, your new email in the system, as soon as Eli flips the switch, will switch over to @starvalleyhealth.org. And please, going forward, we'll go with that. There's a document I'll be sending out regarding email signatures and things like that that will probably assist in that process to help explain a little bit more when we do switch over the first full week in May, what we need to do there and how that affects you. But that's one of the major ones too, is email addresses. But please don't be concerned about not receiving emails, because it'll still go to you for a very long time. In fact, Eli, right, it'll go forever if we wanted to.
Yeah, as long as we just, whatever.
So yeah, whatever. So we'll set a time. Realistically, I would say a year would be sufficient for people to get used to the email address. If you get contacted, it's pretty simple. You can share the news, right? But if somebody starts asking you questions and starts probing, the recommendation is just get a hold of Joel. That's his role, right? He's the Vice President of Communications. You can look him up and his information's there. Just get a hold of Joel, say, hey, this is what's happening, and just always refer to Joel or myself if it starts getting very detailed or you feel uncomfortable. Once again, this is exciting news. This is awesome because this is a new brand. It's a new take on our organization. However, at this point, it's an awesome reset, essentially, is what it is, where we can build and create this how we want it, and I need your help. Because as Tori showed throughout the process, and I'll share with you this is my opinion from my career and what I've seen. 15 to 20% of a brand experience, yes, it's the aesthetics, yes, it's the commercials or the advertisements, it's the colors, it's things like that, but that's only 15 to 20% of it, right? The other 80 to 85% of the brand experience and how people view you as an organization is how they're treated, is the customer service they receive. So as much as I could stand up on a soapbox, I could advertise, I could do whatever, I could pick great colors, I could pick whatever ugly colors, maybe you think the logo is ugly, but whatever, I can only do so much because about 15 to 20% of it is that piece. The 80 to 85% is what you guys do on a daily basis. And so please let me know any feedback, implementation, processes, procedures, let your directors know. If anything, just voice your opinion, please, because we need it. We need you guys in every aspect, in every position. So, any last second questions here?
Hey, Jordan.
Yes.
I'm kind of playing the devil's advocate.
That's great.
I can understand, what we're doing. On the other side of that, I think we're working really hard to make Star Valley Medical Center what it is. And just like UUMC and Premier Children's Medical, people look at those because of who they are and who they've become. Do you think that will be a problem at all, switching over?
No, I don't think it will. And I think because those that are used to us and that truly are advocates for us, it'll be a fairly easy change. The main question is why? Why are you switching? Which is that point that we're drastically different than what we were. But you're right, there are long-standing brands that have been around forever and ever. However, they were set up appropriately where their brand adequately communicates who they are going forward. And that's part of a brand approach when you set up a brand and when you think about rebranding or you think about naming things, which kind of sounds silly, like, well, what do we call it? Well, just pick a name, right? Strategically, you have to think about who you are and where you would like to be. Because you might outgrow that as time passes. And in our situation, we did. But at the time that we picked that name in 1999, I don't honestly know if the people in that room ever imagined we'd get to the magnitude and size that we are today, which is incredible. They would be very proud, and hopefully if they're still here with us, right, they are proud of that. But you have to be strategic in what you pick. So to answer your question, I don't think it's a huge issue, but it's a lot of my due diligence, right, communicating that, hey, if you like us and you've been with us, we're still the same great organization, but we're improved even greater, even better. If you haven't been with us, give us a shot, and this is a reason why. So hopefully that answers your question and explains a little bit more, and a lot of it's in the approach of how we build it.
Also, if you go back and look at some of those companies you just mentioned, over time, their colors have changed, their emblem has changed, so going from the SV, which to be honest with you, we showed this to some folks, and they've lived here their entire life, and they never saw the SV, or they never saw the heart.
The swans.
They saw swans and so forth, so the name has stayed, but the colors have changed, the emblem has changed, just, again, showing that they're refreshing.
Yeah, and it's sending that advanced, more professional, updated view on things, right? And that's one thing I want to communicate is that we're not throwing everything out the window and saying, hey, we're just a completely new organization, because we're not. And nor do I want to communicate that. But I do want to communicate who we are. And our old brand just wasn't doing it, because that's not who we were anymore. We're a different organization, but we're better. That's the key point. So, great question.
So I know Jackson changed their name also, St. John's Health. So is that part of choosing health?
No, it actually,
It's
unfortunate, but the timing was just coincidental. My understanding, I've been here 7 months now, my understanding it's been discussed for well over a year at least, switching our name over. However, it never happened. When I came in and I discussed freshening up the brand, refreshing things, immediately we looked at each other and the leadership said, if we're refreshing everything, we have already been discussing it for an extended period of time, we might as well do it all at once. Because it makes sense, right? We hate to switch over all the colors, all the logos, all the signs, and then 6 months later we're like, yeah, maybe we should switch our name too. So yeah, it is coincidental that St. John's did switch. St. John's Health. But it goes with that communication of who they are and where they're going.
So out in the clinics, it's people get confused. And I know when Star Valley Medical Center, when they established this, they were Star Valley Medical Center, but now they're showing the outline of services. But for us in the clinics, it's gonna be much more comfortable and less confusing for patients when we say Star Valley Health.
Yeah.
And they're like, well, you're not the hospital, well, you are the hospital, but you're an ER. No, we're not an ER, the ER's an admin.
Yeah, so, and that had a lot, I'm glad you brought that up, that had a lot of play into this, right? We're in Star Valley, but we've expanded north right before in the past. At that time of that picture and that advertisement, we weren't necessarily, I think Alpine was in '96, I want to say. So close to the same time that advertisement was ran, we barely had established a clinic in Alpine. We're now in Bridger Valley, Kemmer, Evanston, orthopedics is in Logan. So we're expanding greatly. So that's why if you go back to Mountain West, if you notice the departments, how do I go back to the other one?
Yeah,
I don't know, sorry.
If you go back to the other logos, Star Valley Care Center, Star Valley Urgent Care, Star Valley Physical Therapy, Star Valley Auxiliary, Star Valley, the one outlier, and it's because they're outside of Star Valley. And the feedback from Evanston, specifically Evanston, even Kemmer a little bit, Logan absolutely was, why in the world do I want to be doing business with Star Valley, whatever? I live in Logan, I live in Bridger Valley, I live in Ogden, I live in Evanston, I live in Rock Springs. So they're the one outlier. You can't see it on this because it's so small right now. Below this, there's what I call the endorsement. It says a service of Star Valley Health.
So how's that gonna affect statements going out?
With regard to what? Like
I mean,
names?
if they go to one of those outlying clinics, are they gonna get a statement from Mountain West or from Star Valley?
I'd have to ask Denise on that, I don't know. It's, however it's set up right now, however it's set up right now with Salt River Orthopedics, I don't see why it would change. Yeah, they're Salt River Orthopedics, but we're billing them however we're billing them now, so it'd be exactly
Basically
the same.
comes out of Star Valley Physicians, and then the service line tells where the service was provided at. That's how the statement's written.
So,
And I don't think we can change that in NPM, maybe there's only one way, but it's just something we're still looking at.
so however, my recommendation right now, just with the limited knowledge I have now, would be however Salt River Orthopedics currently does it, that's how it would be done. Because their name, this is a pretty straightforward change, right? Because they're switching their departmental name. So however they've been billing for the past, since they've existed, that would be the same. But yet more to come on that, so. Any other last second questions, and then, yes?
I was just curious with, some of those other ones, like Star Valley Urgent Care, all those ones that have the specific, location, is the medical center still gonna have Star Valley Medical Center outside, or is it gonna say Star Valley Health?
We've discussed that, and I don't know if we ever came up with it, because the way I'm used to, came from Boise, right? St. Alphonsus, or St. Luke's Health System, their medical center is called St. Luke's Medical Center, or St. Luke's Hospital. St. Al's is St. Alphonsus Medical Center. So that's a great question. I don't think we ever came up with a resolution yet for this specific location, other than we said it'd be campuses potentially. It'd be the Acton campus, which would encompass orthopedics, urgent care, hospital, PT. Thane campus would have, PT and family practice. And then Alpine, eventually we'd get to a point. So it'd probably be more location-based as opposed to name-based, if that makes sense.
Yeah.
So Acton campus, Thane campus, things like that, more how we probably approach that. So I don't want to take any more time. If you have questions, please let me know. Offline, I'd love to talk to you if you have feedback. Like I said, the good, the bad, and the ugly. I'll either say, absolutely, we can do that, I'll look into it, or there's no way. So please just bring up your opinion, and I'll love to talk to you.
All right, I'll try to get through this quick. We're running out of time. We got a lot left to go over. Top part is just key indicators, so we can kind of see where we're at. Inpatient admissions are down 1%. It's just barely over 1%, but our inpatient days are down 2%. That just basically says that our stays are a little shorter than they have been in the past. Surgery visits are up 3%. Surgery minutes are down 2%. So we're seeing shorter surgery times, possibly more outpatient than inpatient, causing minutes to go down. But the volumes are still there and growing. ER visits down 12%. Urgent care visits, this 1945 from last year, that's from October 2017 through June of 2018. So it wasn't a full 9 months. We're doing a 9-month period here, whereas urgent care visits are a full 9 months. So you're seeing an 81% increase. The increase between January and February of last year and this year was a 12% increase in urgent care visits. Clinic visits are down 6%. So those three ER, urgent care, clinic visits, those all move together, and we've talked about that before. Gross operating revenue, we're down 4% from what our budget is. We're having a struggle with some of our gross revenues. Basically, some of it's coming from these reduced volumes that we're seeing. Operating expenses, this red is good, okay? That means we're below our budget, what we had budgeted. So our expenses are coming below that, which is good because that helps make up for some of the lost revenues. So appreciate y'all working on that and trying to keep the expenses down. Operating income, March we had a loss of 531. Year to date we're at 1 million. We had budgeted 2.5. You remember, this is what indicates kind of what cash is kind of coming in. Are we covering at least our operating expenses? We are covering our operating expenses, which is a very good sign. A lot of hospitals can't do that. They are running in the red and have to rely on tax revenues to cover their operating expenses. We're still able to continue to cover our operating expenses. Non-operating revenue are interest income, tax revenues, those kind of things. So our bottom line, right now we're at a loss of 546 as of through March. Our budget was 708 through March, so we're 177% below our net income. Days in accounts receivable, like to try and stay below 50. March, we were at 46. Cash on hand, we like to stay 90 or above. In March, we were at 71 days. Main reason for that is in March, we had 3 pay periods. The last pay period ended up on the last day of March, so we had a huge outflow of cash, 500 days cash on hand. We're back up into the low 80s as of today, so. Quick overview, any questions? Okay.
Woo! He goes the fastest one ever.
All right, so real quick, before I turn the time over to Sarah to do the short-term disability policy, just an update on a policy with space heaters. The safety committee reviewed that policy, and there's an NFPA fire prevention policy that basically says you can't have space heaters in a patient care area, and so in order to standardize that for the whole hospital, we are requiring that we don't have any more space heaters. And so if you do have one, we will need to get rid of that space heater. And I do apologize, I know it's going to be a challenge for some of you to keep warm, but it is a requirement. We feel strongly as a safety committee that we need to remove all the space heaters from the hospital and the campus in general. So, any questions?
I even use it in the summer.
Right now, I don't have a good answer for that.
Ross had said that you guys could put in a ticket, and his team will evaluate if we can do fixes in specific cold areas. There are unfortunately areas that they can't do fixes, but each one will log, make sure to reach out, put a maintenance ticket in, they'll come and evaluate on a case-by-case basis. If you're around a bunch of people that like it a little cooler than you, it might not work, but if you're like Trevor's office where you've got leakage through windows, it's possible that that could be fixed.
Yeah. All right, thanks. I'll get down before you start throwing things at me.
All right, I just want to make sure everyone is aware of our short-term disability policy. So if you are full-time and you are out longer than 1 week, you need to come see me because you are eligible for money. Everyone likes to get paid. So I know we've only had it for 4 short months, and I've had to contact 5 different people to come and fill out the paperwork so that you can get money. So if you are a full-time employee, this benefit is for you. So I know all you have to do be as a full-time employee and long enough the insurance is kicked in. So if you started in January and you had to take a leave in March, this benefit is for you. Even if you said, no, I'm not taking medical insurance, you still get it, okay? So all you have to do is come in and see me. This policy, it will pay you 60% of your income, and it helps, you don't have to use all your PTO before it kicks in. The only requirement is you have to use all your long-term sick. So if you, mothers going out on maternity leave, even if you have not been here for a year and do not qualify for FMLA, you still need to come see me because you do still qualify for the short-term disability. So even though you don't have enough long-term sick, not enough PTO because you haven't been here very long, this policy is still going to pay you 60% of your income. Okay? You get sick, you're out sick for 2 weeks, you only have to use your long-term sick for 1 week, or you only have to use PTO for 1 week, and then the next week, this will help pay you if you're out of PTO. Does that make sense to everybody? Any questions? Okay, make sure you come see me if you're out for longer than a week. Yes, Cynthia?
Do you want to mention what we talked about the other day with the insurance and how it affects your insurance if you don't have PTO? You know what I'm talking about, the conversation we had?
No.
that they have to pay their own insurance if they're out, but they only get so many weeks if they don't qualify for FMLA.
Oh, okay.
Because I didn't know that until I talked to you the other day.
Okay, so if you have not been here for a year and you do not qualify for FMLA, and you end up on a leave, our medical insurance says that you can only be on our plan, it's in the plan documents, you can only be on there for 6 weeks. So if you end up needing a surgery, we can only let you be on the insurance for 6 weeks, and then you will be kicked off. Because you don't qualify for FMLA, so there is not a reason to keep you on the insurance. So, for leave-wise, we usually like to only, if you don't qualify for FMLA, our policy is 6 weeks. We allow 6 weeks, and then it then goes to committee, which is administration, as to whether or not you will remain an employee if you have to stay out or not. So, please note also on this policy, short-term disability, that if you do go on leave and you don't have any PTO, you will have to still bring me a check for insurance to stay on the insurance, because you still have to pay your insurance premiums out of your paycheck. If you're not getting a paycheck, you can't pay them, so you will have to bring me the money. Yes, Pam?
Are we accruing, short-term sick?
Yep.
So if I have a week of short-term sick and I'm out for 2 weeks, I can use my short-term sick and then go to.
Yep, so there is a waiting period, so you use your short-term sick for that first week, and then the second week, 60% of your income is gonna come from this, and then you could use 16 hours if you work 80 of PTO. So you don't have to use all your PTO, and your PTO is going to last longer, because you're only allowed to use 40% of it, of your work hours. Because we don't want to pay you 40 hours and you get 60% of this as well, because then it's saying, hey, everybody go on leave. That doesn't make sense. So you're only allowed to use PTO up to 40% to cover the other. Any other questions? Those were great. All right, thank you.
All right, so new employees, we've hired Dr. Eric McClure as an anesthesiologist, David Reese as a paramedic, Allison Reinhardt is in admissions and urgent care, Grady McQueen for EMS, Katie Johns is a CNA at Med-Surg, Dakota Hoyt in the dietary department, Kylie Merritt in environmental services, Stephen Britton in dietary, Shadow Cost is an MA in the physician's clinic, Gina Snow is a speech therapist, Mandy Larson in admissions, Venus Brooks in dietary, Christy Sidwell for the Bridger Valley Urgent Care admissions, Taryn Pelletier, MA in the urgent care, Casey Burdick in dietary, Haley Ludwig as an MA in an ortho clinic, Tyler Johnson is an EMS driver, Abigail Coles is a CNA on Med-Surg, and then here's a reminder of our open positions, so I think we're whittling the list down just a little bit. And then I want to jump into our employee engagement survey. So I'm not going to spend a lot of time going through the results of the survey. More of it I want to go through the process and what we'll be doing with the results that we have. Just a quick overview of how we did on the survey. Our overall engagement score was 78. So what that means is 78% of our employees feel like they're engaged at work, which is really good. When we look at the national benchmark data that we have, the average is about 70%. So we're 8 points higher than the average. And like I said, I'm not going to go through each of the questions, but we have a really engaged group of employees, and it's awesome. It's very helpful to run a business with engaged employees. Engaged means you're the ones that are willing to do the extra effort, to go above and beyond, to oversee things that maybe don't fall right in your wheelhouse. So that means a lot to an employer to have employees like that. So great job. We appreciate all your extra effort. Yes, and this is where the score comes from, so the overall score, you'll notice here is 78%, and those are the ones that strongly agree that they're engaged. Loyalty is great. We have 77% of our employees are high commitment, and they'll be working at Star Valley Medical Center in the foreseeable future. 7% are high commitment, but may not be working at SVMC in the future. 9% are low commitment and will not be working in SVMC in the future. And then 6% are those employees that are in jeopardy. Those are the ones that are low commitment and they don't plan to work here in the future. Most of our employees have been here between 2 to 10 years or more, so that's great too. We have a lot of long-term employees. And given the choice, most people would like to work here 5+ years. So again, really good results. This one was a great indicator for me. You know, if you're proud to work for your organization, I think that says a lot about the way where you're at as an employee. 87% feel proud to work for Star Valley Medical Center. Again, these your department director actually has the engagement survey, and so if you have questions individually that you want to talk about, you're welcome to get with them. Supervisors, it looks like most people feel that our supervisors treat them with respect. 86% agreed with that. A little bit of area for improvement with taking action with poor performers. That was something that you guys felt like you could do a better job of. And then this is an interesting page. It shows all the areas that the survey company feels we're doing a great job in. So there's a lot of green there that's very positive. Here's some areas that we can improve. Yellow is still good, but not where we'd like it. And then the bottom, the red there, are areas that we really need to take action and do a better job in. So with that in mind, one of the things that we'll be doing through this process is I've sent the results of the survey to every department director, and we've asked them to get with their departments and go through an action plan. The action plan is going to be a little bit different based on your department and the specific needs of your department. But basically what we'd like is actionable things that we can do as an organization to make us better. So the top 3 issues for this group here: SVMC values my ideas and opinions, my supervisors take appropriate action to deal with poor performers, and my benefits are comparable to others working at healthcare facilities in the area. So those are action areas that we need to improve. So what are your ideas for improvement? And we want, you know, not just a general overview. We want specific actionable things that you feel we can do to improve in those areas. And you'll brainstorm that with your department, and then we want that information back to us, and we'll implement that in the strategic planning process for the coming year. So we really need your help and your support to be able to improve in those areas. Lastly, I wanted to show real quick the benchmark data for where we are in comparison with national data that we have from the survey company. So you'll notice our overall average is 76.61, which is 6 points higher than the national average. And in some of these areas, we're doing a really good job. You know, overall satisfaction with the medical center is 13 points higher than the national average. So great job on the survey. We really couldn't do it without you, and we do appreciate you know, the engagement that you have. It really does help an organization to be an employer of choice when you have committed and engaged employees. Any questions on the survey?
We're already over the hour, so we'll be really quick. You'll notice we hired
another Dr. McClure, and that's to give Dr. Brian McClure some more time with pain management. There's only a handful of individuals in the state that have the level of expertise being an anesthesiologist and fellowship trained in pain that he does. We're very lucky to have that resource in this valley. And so he's going to expand his clinic time as well as his procedure time here in Afton. He is already going to Kemmer a couple times a month, and then he'd likely to also expand that service in Bridger Valley or Evanston. And so we want to make sure that we're using the expertise that he has. And so Dr. Eric McClure will cover a lot of that OR and anesthesiologist time that when Dr. Brian McClure steps out into the clinic and does his pain procedures. Some other exciting developments, we're really close to an accepted offer from a pediatrician. That pediatrician would focus her time in the River Valley, especially until we have some more space, clinic space available in Alpine. But we're really close to that, and we're also close to hiring a board-certified ER physician. And we're really close on that one too. So we hope to announce those two soon. And then in addition to that, just a quick word on ACO, and Jamie can add anything to that she wants, is that process is going, I'd say, very well, given the individuals that we have leading that process. And to me, which is most important as far as what we do as an organization, is I feel that we're providing better care through that process and through those changes. And so we're spending more time with the patient. We're providing more education right now to Medicare patients on their health, the screenings that they need. We're improving the screening rates, and we're also improving primarily the number of wellness exams that we do as an organization. And so we should be proud of that involvement and proud of the work that's being done in that area. Because there's a lot of movement. There was even a big announcement yesterday that Medicare, they're going to start paying physicians directly lump sums of money to take care of a certain number of patients, instead of just paying based on number of clinic visits. And so it was a big announcement they had yesterday. And so, we're in a good position. We're now the only accountable care organization in the state of Wyoming. Idaho, so our neighbor, they're trying to start a statewide ACO, but we're in a good position to lead some of that change that is coming upon us. Jamie, anything to add to that? And then just a quick word from the board. Their meeting focused yesterday primarily on capital budget. Right now it's budget time, so we're going through the capital budget process, and so they looked at the current capital list, the draft list. They'll approve that next month, and then they also looked at the draft for our strategic plan for next fiscal year, and they won't approve that until June. So majority of the time is focused on those two things. And then some upcoming events. It is event season, so when Pam's running, and so we have the health fair that's coming up, and the change do we alternate years as far as where we're at? But
Yeah, this year it's
so this year we're in Thane, and then of course we have our fun run and walk that's coming up on the 11th. And then a play and plug, which is so popular last year, we're doing that again. We already have multiple businesses that have signed up, 27 businesses that have signed up. And so that'll be kicking off May 27th. And then for a hospital week, which is also in between those other events, so we'll have a barbecue, and that'll be on Monday, May 13th. There'll be an employee car wash. There'll be more details to come. And so if you want your car washed, get it really dirty now. And so we'll get it clean for you on the 14th. We're going to do a community service project and some hygiene kits, which you raised so much money, and we're so generous on raising that. That'll happen on May 15th. On May 16th, there'll be a mobile Wheel of Fortune that'll be coming around. And then on May 17th, we'll have a Sunday party. Wait,
On May 13th, on that Monday with the barbecue, we're hoping to get a lot of people up here. Part of the brand change, we'll be changing logos on name badges. So we'll be trying to take as many pictures as we can, just so you're aware. If you want to look nice for your picture, we'll be trying to cover a lot of those on Monday, the 13th up here, while you're in line for your barbecue.
are there any questions on anything we discussed or anything else? Anybody's wondering? So there's, we're gonna do a drawing for some prizes, but then also it's the opportunity to, if you want, I think there's shirts, some jackets, blankets with the old logo on there. I think that's available if you're interested in taking that. There's some nice golf shirts and sweaters and so forth. So if you're interested, please look at that table.
There's also some branding with new brand. There's also some stuff you can look at. Don't take anything yet because we're going to be giving all of that out as a health and safety center this year and all kinds of stuff at that time. But you can come take a look and see how it looks on stationery and business cards and so on.
Sandy. And Russ. Thank you.